of the technologies I'm going to talk about, well, all of them I use in my daily life, but I'm fascinated by the impact of technology on a whole range of different areas. And today I want to share some thoughts with you on the impact of technology on nursing. Technology is a great enabler. And one of the things that it's done in all aspects of life, in all types of jobs, it's changed people's roles, responsibilities, and practices. And in fact, it's increased the capability of nurses to take on a wider range of roles supported by technology. And technology also not only empowers people in their jobs, nurses, doctors, etc., but it also disrupts long-established practices. And many of the jobs that previously might have been done by skilled practitioners with many years of experience, with the support of technology, can now be done by people in different grades. And as an example of this, just an anecdotal example, the pictures there show you a surgical operation. On the left-hand side, you can see a traditional operating theatre with surgeons working on a process. Next to that, you see a lady using a laparoscopic trainer. So this is using technology to train people to do laparoscopic surgery. So what she's seeing on the screen is actually a gallstone, and she's using the laparoscopic tools to remove the gallstone. And in this training exercise, she gets haptic feedback so she can feel what's going on when she's using the tools. She can see what's going on, and she gets marked according to the speed and the accuracy of her surgical process. Now, it may surprise you to know that the lady who's doing that is my partner. She has absolutely no training in medicine whatsoever. She doesn't even play computer games. But the results that she was getting using this kind of technology were equivalent to a trainee surgeon. So the point I'm trying to make is not to suggest that we should let loose people in operating theatres with less training. The point I'm trying to make is that technology can empower and help to accelerate training. And on the right-hand side, you can see how technology has been used with robotic surgery. And this combination of a human being and technology can help us to deliver much more precise surgical operations, but it disrupts existing practices. And the same is true when it comes to training and education. And virtual reality has a role to play in training nurses and doctors and all manner of personnel. So the kind of technologies that I think are important, not just in nursing, but everywhere else, particularly artificial intelligence and machine learning, to support the daily practices. But also when it comes to understanding what's going on with patients, the use of wearables and biometric devices which measure the standard vital signs are now becoming really much more consumer type devices. And these can only function if we have high-speed networks such as 5G and broadband. So smartphones and mobile applications have a role to play. And now, increasingly, the use of virtual reality and simulation supported by the Internet of Things is playing an increasingly important role, not only in training, but also in jobs. Now, the thing is that coronavirus has had a major impact on all our lives. And one of the things that it's done is it's accelerated the digital revolution. And things that we might have done occasionally, like Zoom calls, like webinars like this in the past, are now becoming much more commonplace. So we're doing things quite a bit differently, and that's been accelerated by COVID-19. So when we look at the impact of COVID-19 on patient care and how that might affect nursing, COVID-19 has placed restrictions on our physical contact, and accordingly, it's increased the demand for remote care, care where the doctor or the nurse doesn't have to be in the same room as a patient, telemedicine. It's also accelerated the use of wearable devices. I have two wearable devices that I use for my own purposes, to monitor my own vital signs and help me to manage my own personal health. And all of these things are being accelerated or have been accelerated by COVID-19. And now we're shifting away from medicine as an idea of curing problems, but more towards preventative health care and an integration of care services. So looking at some of these changes, if we look first at remote patient care, as I mentioned, this has been accelerated by COVID-19. And the case of one of my collaboration partners, a company called Spirit Healthcare, who specialize in remote patient care, the use of these technologies has helped to reduce visits by GP visits by 15 and practice nurse visits by 35. And so the future of care is shifting from hospitals towards homes and community care. And this company, Spirit Digital, this is a little promotional
video. The digital health revolution has been accelerated by the need to look at new ways of connecting patients to clinicians due to the COVID-19 pandemic, and minds have been expanded by the opportunities that technology can provide to ensure safe and responsive care in the right settings for patients. Of course, this was the need before the pandemic, as nationally and internationally healthcare systems were compromised by a mismatch between patient need and the capacity of systems.
To help them understand their condition
CTV connects patients, clinicians and carers, which
better.
delivers an enhanced service through a digital pathway.
You can see the results of this.
Clinic
not
Touch
only
B provides a
can
view
people
of
be
a
cared
patient's
for in their own
debility
home
or
rather than
early
hospital,
deterioration, which allows a clinical team to intervene much earlier. By providing real-time data, CTV guides decision-making as the clinical caseload is automatically prioritised. Clinicians can undertake remote care planning with confidence and use video and messaging to communicate. CTV blends soft science and physiological data in clinically validated question sets, providing a complete picture of a person's health. We provide health trend information which
care. So this combination of technology combined with empathy can make remote patient care a real possibility without reducing the level of care, providing it's done with the right level of empathy. And of course, being able to do webinars and to do remote Zoom calls like this is also a way in which nurses and carers and workers can connect to each other in a very empathetic way, much better than just a telephone call where you can't see the person's face that you're talking to at the other end. So we're faced with many challenges in the world today, and one of these is the aging society and the fact as we get older, we tend to have more medical problems. And as the aging population increases, there are fewer and fewer people able to support the challenges of elderly care. And our lifestyles, and this is where technology perhaps has a negative effect, our lifestyles are one of the most important causes of some of the problems in elderly life. It's not just physical complaints like chronic conditions like obesity, smoking, cardiovascular disease, etc., but also problems to do with social isolation and mental health. So we have some serious problems in society that are related to the aging society. I have personal experience of this myself over the last year, 2021. My partner's father was living with us. he had to come to live with us because he was no longer, him and his partner were no longer able to look after each other. He was 96 years old with multiple health problems. And in the picture on the right, you can see the number of drugs that he was being prescribed. And this was the responsibility of my partner to make sure that he had the right drugs and he took them at the right time in his life. Now, as I got towards the end of his life, in the last month of his life, that was reduced to the number of drugs that you see on the right-hand side. So it was a different kind of drug regime in his end of life care. So there are real problems with comorbidity when you're getting older. And what I'm seeing as an impact of technology is that technology is enabling a higher level of care and less dependence on drugs through a combination of these kinds of technologies and partnerships with a range of different organizations, some of which are within public health services, like the National Health Services in the UK, but some of which are outside care providers, are all collaborating, but working with a more intimate knowledge and a common knowledge and a sharing of knowledge about the patient, and treating them as an individual. So as we're making this transition from cure to prevention, it's very important that we use technology to adjust our lifestyle behaviors. And this is where nurses can come in very much to help their patients and the people that they work with to better manage their personal health, whether it's giving advice or pointing them to different kinds of technologies, which might be measuring their blood pressure, encouraging them to be more physically active, or helping them with their mental health. So there's a great role for nurses as coaches, mentors, and facilitators in the preventative health care. Now, when we look at virtual reality and simulations, this is something which isn't entirely new. The picture that you see on the screen there, it was actually a training program for paramedics that was developed in around about 2008 by a video games company. And what it shows is an explosion, or the aftermath of an explosion in a city centre. And on the right-hand side, there is the triage protocol. And there is a patient exhibiting all the signs of somebody with a serious injury as a result of the explosion. And the idea behind this video simulation was that the paramedic used the computer to basically triage the patient. And the game marked the paramedic on the basis of how quickly and accurately they did the triage. And the net results of this is, when you compare traditional training with mannequins or actors, the use of technology to do training produce significantly better results, primarily because the paramedics felt that it was a real situation that they were working with. So it's so realistic. And this is an example of the kind of technology the games company used to simulate what happens to someone when they die from a head wound. So on the left-hand side, you see the healthy person. And in this animation and this video, you saw how that person deteriorated over a period of 60 seconds. And the point about this is that you can create simulations which give people experience of rare medical scenarios that they may not hopefully come across in their lifetime, but if they are, they will have had some experience of it. And today, we not only have these simulations using virtual reality headsets, but we can also live stream training and live stream operations, which can be seen simultaneously by thousands of people. And on one of the very first live streaming operations in virtual reality, this was actually watched live by 3,000 people with a virtual reality headset. You would never get that number of people into an operating theatre. So it made the training accessible to a wider range of people. Now, moving on to some of the tools that are available in digital medicine and digital therapeutics that help to deliver treatment, help people to manage their own health better. On the left-hand side, we show the latest generation of wearable technologies, which actually takes the form of a kind of plaster, which is intelligent, which has sensors and measures vital signs. And that can be something that be worn on the arm. But also on the digital therapeutics, the use of virtual reality headset increasingly is a viable and importantly effective alternative to drug treatment. This is an example of a digital therapeutic for active aging. It's also used for rehabilitation. And essentially, the patient plays a game and just use their body and their arm movement to play a game. And that not only exercises whether it's a cognitive training or physical training, it's personalized to the individual patient and can be monitored remotely by the physiotherapist. So this is just a short video of how it works using rehabilitation with games. See the patient there is trying to move the device around the maze. And these games are developed in partnership between patients and physiotherapists, designed to be fun and engaging. They help very much with, particularly with physiotherapy, they help very much with compliance. So this game exercises lower limbs, and this one exercise drug balance. So people move from side to side. Cognitive games where you've got to match different devices on the screen. And this company developed a range of pathology-specific rehabilitation solutions that use technology in a person's home, so they can train at home rather than having to go to a specialized clinic, and they can have personalized therapy plans. This is one that I use as an example of how you can give physical exercise to someone who maybe even be in a wheelchair, but give them exercise and allow them to basically go on bike rides anywhere in the world. So the still picture you see there is me sat at my desk with a virtual reality headset, and I have this little device in front of me that I can pedal either with my hands, or I can put it on the floor and pedal with my feet. So this is the video. This actually shows what happens when you do the exercise.
Start recording a video, which will be.
And so I recorded it. So I'm sat there at this little device. So as I'm pedaling, you can see what I see on my headset. I'm pedaling through Yosemite Park in the USA.
Is actually taken from
and I can do it with a coach, but it's a fun way of giving people who may otherwise be immobile a chance to have some cardiovascular exercise and have a bit of fun at the same time.
Virtual rides from.
So digital therapeutics, the solutions today are available for both physical and mental health. And particularly when you're dealing with elder people, they must be what I call plug and play. You must be able to basically use your television set, switch it on, and be able to do these exercises. And if you're going to get compliance, it's important to create realistic challenges for the patient and combine them with a bit of fun, and also, where possible, engage with the family and the community. And all of these technologies provide feedback and diagnostics, so that they not only help you to track your health, but also give you some sort of motivation and give you more control over your own health. So in summary, COVID-19 really has accelerated the use of these technologies in health services, and the nursing profession will be impacted by these changes as much, if not more, than many other professions. And these technologies are both empowering and disruptive. What it means is that nurses' roles will change over time as the way in which health services are provided, and the focus shifts to preventative healthcare. And nurses will take on, I think, increasingly important roles which might have been done by what you might regard as higher grade clinical personnel. Virtual reality and simulations will also help with the training. But for the nurses themselves and their patients, the use of digital therapeutics can support stress management, can help them to deal with some of the strains that you're all aware of in the current COVID-19 crisis. So that is my presentation.